My name is Brandon Barlow, and today my presentation for advanced procedures is on breast cancer and mammography and how it has helped millions of women today survive breast cancer. So I decided to do my case study on my mom, Dodie Barlow. She had breast cancer back in 1996. She was 50 years old. She felt a lump on her breast. She went in to see her doctor. Her doctor sent her out for a mammogram, and her mammogram showed that she had something abnormal on it. So then she came back to her doctor. Her doctor then sent her out to a specialist, an oncologist, and he thought maybe it was a cyst, so he removed fluid. Turned out that it wasn't a cyst, so they ended up doing a biopsy, and the biopsy came back that she did have cancer. So they set up a plan. The plan was to first remove the tumor. So they removed the tumor. Then she had chemotherapy. She had chemotherapy for about 3 months, twice a week. And then she had radiation 5 days a week for 6 weeks. She is now 25 years cancer-free and happy as can be. So what is breast cancer? Breast cancer is cancer that forms in the breast and begins to grow out of control. After skin cancer, breast cancer is the next common cancer diagnosis in women, and their breast cancer cells usually are tumors. There are two types, benign tumors and malignant. So benign tumors are tumors that usually stay in the breast and they resemble the other cells of the breast. A majority, a high percentage of tumors in the breast, most breast lumps are benign and not cancerous. And some types of benign lumps can increase your risk of getting breast cancer. The other one is malignant. Malignant tumors are cancerous, and they are very aggressive, and they can spread to other parts of the body. They can spread outside the breast. Most breast cancers are carcinomas or tumors. They usually start within the epithelial cells that line organs and tissues. Common types of breast cancer. So a couple common types here. Ductal carcinoma in situ, lobular carcinoma in situ, invasive ductal carcinoma, and the last one, invasive lobular carcinoma. So my mom had invasive ductal carcinoma, and it's cancer that starts in the milk duct and usually spreads to other areas of the breast and can even spread outside the breast to other parts of the body. It's the most common type of breast cancer. 8 in 10 that are diagnosed with breast cancer usually have this invasive ductal carcinoma. And it's able to spread to other body parts like through the lymph system and the bloodstream. So in my mom's case, hers did spread. They ended up removing a few of her lymph nodes as well as the tumor in her breast. And I think she said 2 or 3 came back with cancer, lymph nodes. So obviously with that diagnosis, they had to start with the chemotherapy and also do the radiation therapy to make sure that they got all of the cancer. All right, symptoms and causes. So usually the big symptom is that women can feel a lump or a thickening in their breast. They can also maybe a change in the size or the shape or the appearance of the breast. Sometimes there's a dimpling in the skin of the breast. Also a crusting or flaking kind of around the nipple area of the skin. And then the last one is redness or pitting on the skin over the breast, like the skin, like skin of an orange. So you talked about that, Mrs. B, in your slide, the peau d'orange that's on here as well. So those are a few of the symptoms. Causes. So breast cancers begin to grow abnormally. Complex interaction of your complex interaction of your genetic makeup and your environment. It's hormonal. It can be hormonal, your lifestyle, what you do, and then your environmental factors, where you work, your job, and where you live. And it's also 5 to 10% are linked to gene mutation passed through generations of family. So obviously, if it runs in your family, this is a concern. All right, so who is at risk? So studies have shown that breast cancer is due to a combination of factors. So the main factor is being older. So it's usually women 50 years and older. Genetic mutations, so changes to genes like the BRCA1 and the BRCA2. Reproductive history, so if you have a menstrual cycle starting early, like age 12, and then you don't have your menopause until, say, after age 55, you're exposed to more hormones throughout your life, which can increase your risk of breast cancer. Dense breasts, so if your breast has more connective tissue, it's harder to see or spot on a mammogram. So that's a risk factor, because if you can't find it, then obviously it's going to possibly spread, maybe. Family history of breast cancer, which is in my mom's case, it didn't really run in our family, so it wasn't something that that was in her family line, or even my dad's family line. So radiation therapy before the age of 30, and then women who took the drug DES, it was given to pregnant women to prevent miscarriage between 1940 and 1971. It increased your estrogen level, and this was a reason that you could be at risk if you took that drug. All right, so mammography. Mammography is the most sensitive and accurate screening modality available for detecting early breast cancer. I'm thankful for mammography because it's saved my mom's life, and it's also saved, probably millions of women's lives as well. So I'm grateful for this modality, and it's the process of using low energy X-rays to examine the human breast. So kind of how it works is women, they'll put their breast on the plate, and then what the mammogram does is it smushes the breast down, so it's kind of like this. This is kind of how it would work, and then the X-ray would come down straight through the breast, and then you would get the X-ray, and then they would do a side view, a lateral view as well. So just kind of a fun way to show it with a cupcake breast. And mammography is used as a diagnostic screening tool, so we've covered that a little bit. Women 50 or older should get annual checkups to make sure nothing is changing or anything abnormal in their breasts. And most important innovation in breast cancer control since the mastectomy back in 1898. So right here I have 3 mammograms. You can see the first one is a normal mammogram. Second one is a benign cyst. This is what they thought my mom had, but it turned out to be actual cancer. And so the awesome thing with mammograms is that they can see exactly where the tumor is, and that's important because when they come in here and they're doing the surgery and trying to find exactly where the tumor is, and they're getting it all out, they come in and they just take a little slice of the breast there, and then they go in there and they remove, I'm not a surgeon, oh, I just ruined my breast. And they remove the cyst, which we use as a gumball. I'm not a very good surgeon, I just ruined this nice breast, but I'll put it back together. And that was just kind of the way mammogram is used, so the surgeon can see exactly where the tumor is, so he knows exactly where to go in, and he can remove it, make sure he gets all of the cancer out so that it doesn't come back. And like I said, with my mom, he had to remove some lymph nodes as well to make sure that to make sure the cancer hadn't spread. She thought she was probably stage 3. She didn't know for sure, yeah. All right, so next slide is the treatment options. So treatment options depend, we kind of showed it here, surgery, you go in and remove it. Chemotherapy, hormonal therapy, biological therapy, and radiation therapy. So when my mom did it, she actually had the tumor removed first, then she did the chemotherapy, and then she had radiation therapy. But today they do it a little different. First they use the chemotherapy and try to shrink the tumor, and then they remove the tumor after that, and then they do the radiation therapy. So I thought it was kind of interesting. And she said that when she did it back then, she kind of said it was a little experimental. Back then, she actually did chemotherapy 2 days in a row, which I guess was kind of like not how they did it. But she did say that she had a good doctor that made sure he got all of the cancer. And obviously he did, because she's still here today. This is a chart that I found on cancer.org. It is the 5-year relative survival rates. Kind of talks, it kind of shows how, like, depending on how far the cancer has spread. So the first one is localized. It says no sign cancer has spread outside the breast, 99% survival. The next one is regional. Cancer has spread outside the breast. You have an 86% chance. That was my mom, because it had spread outside the breast. So go mom, 86%. She's in that number. The next one is the distant. Cancer has spread to distant parts of the body, such as lungs or bones. So obviously 28% chance survival. This is probably stage 5. So you can see how important it is that you catch breast cancer early before it spreads. Another reason why mammography is such an important modality today, because it has probably helped many women catch it early and survive cancer. All right, so on to the last slide. This is prevention. Cancer prevention is action taken to lower the chances of getting cancer. Obviously, we have the normal cancer risk factors. You shouldn't smoke, shouldn't be overweight, and you should exercise. All good things to do to help prevent cancer. If it runs in your family, you should talk to your doctor about prevention. You should have annual checkups. Mammograms obviously is the number one checkup you should be doing, especially if it runs in your family. Mrs. B, you talked about it in your lecture, that they're kind of saying maybe starting at age 40 you should start kind of having mammograms, but you said it's a lot of radiation, so 45 if you feel like it kind of runs in your family. Eating right is important. It's important in everything we do. Obviously, eating the right things, staying away from foods that can cause cancer. Less exposure to estrogen. If you get high amounts of estrogen, they say that can lead to breast cancer. You can also, many women today have chosen to do mastectomies, and that is to remove all of the tissue of the breast. And a famous person that did it was Angelina Jolie. She did it, and because it ran in her family, and she didn't want to even take that chance. And then finally, there's still trials going on today to try to see if there's better options or better ways to prevent cancer. And so I just want to end by saying that I'm thankful for advanced modalities such as mammogram in radiography. For obviously, my mom is alive because of it today. Many women as well, millions, probably maybe billions, are still alive today because of mammography. And I think it's an important modality for that reason, that it saves lives. So I just want to say thanks, and I hope you enjoyed the slides.